What if I told you that 12 specific changes in your hands and feet are urgent warning signs of serious lung disease, signs that pulmonologists check immediately during examinations because they reveal critical information about your respiratory health, yet most seniors have no idea these connections exist and ignore these warnings until it's too late. Right now, millions of people over 60 have visible changes in their hands and feet that are screaming warnings about lung problems, changes they dismiss as arthritis, aging, or circulation issues when they're actually manifestations of life-threatening respiratory disease. Meanwhile, those who learned to recognize these 12 signs caught their lung problems in early stages, sought immediate medical attention, and received treatment that prevented progression to severe, irreversible disease. This isn't about general symptoms or vague discomfort. These are 12 specific, visible, measurable changes in the physical appearance and function of your hands and feet that directly correlate with serious lung conditions including chronic obstructive pulmonary disease, pulmonary fibrosis, lung cancer, pulmonary hypertension, and other conditions that can be fatal if not caught early. Your hands and feet are diagnostic windows into your lung health, showing signs that appear long before you experience severe breathlessness or other obvious respiratory symptoms. In the next few minutes, I'm going to reveal these 12 critical signs in your hands and feet that indicate lung disease. I'll explain exactly what each sign means, which lung conditions it indicates, and why it's urgent. I'll teach you how to examine your own hands and feet systematically to check for these signs. And I'll share the powerful stories of people whose lives were saved because they or their doctors recognized these warning signs and acted immediately. Your hands and feet might be showing you urgent lung disease warnings right now. Learning to recognize them could literally save your life by enabling early detection and treatment while your lungs can still recover. If you're over 60, you've probably noticed various changes in your hands and feet over the years. Maybe your fingers look different than they used to. Perhaps your nails have changed in appearance. You might have swelling or color changes you've attributed to poor circulation or arthritis. You could have temperature differences or other variations that seem like minor age-related changes. Most people dismiss these changes as inevitable parts of getting older, never realizing they could be urgent warnings about serious lung disease that needs immediate attention. Here's what almost nobody outside the medical profession understands. Your hands and feet are supplied by the same oxygenated blood that your lungs produce. When your lungs aren't functioning properly, when they're not adequately oxygenating your blood or when lung disease is creating pressure problems in your cardiovascular system, your hands and feet show specific, predictable changes. These changes appear because your extremities are the farthest points from your heart and lungs, making them the first places where oxygen deficiency and circulation problems become visible. Pulmonologists know that examining hands and feet is an essential part of respiratory assessment. They check for specific signs that have high predictive value for serious lung conditions. A skilled respiratory specialist can often determine whether significant lung disease is present simply by examining a patient's hands and feet. Yet this knowledge rarely reaches the general public. Most seniors have never been taught what to look for, what changes are meaningful versus benign, or when to seek urgent medical evaluation. After 60, your risk of lung disease increases significantly due to lifetime exposures, natural aging of respiratory tissues, and accumulated damage from environmental factors. This makes it even more critical to know these 12 warning signs because early detection of lung disease in seniors can mean the difference between treatable conditions and advanced disease with poor prognosis. These signs appear early, often months or even years before breathlessness becomes severe, giving you a crucial window for intervention. Thousands of seniors who learned about these 12 hand and feet signs and checked themselves discovered early warnings of lung disease they had no idea they had. They sought immediate medical evaluation, received diagnoses of serious conditions in early stages, got appropriate treatment, and avoided the severe decline and potential death that would have occurred if diagnosis had been delayed. Early detection through recognizing these signs literally saved their lives and preserved their lung function. Now let me reveal the 12 signs of lung disease in your hands and feet that seniors should never ignore, explaining what each sign indicates and why immediate medical evaluation is essential. Sign number 1 is clubbing of the fingers, the single most important hand sign of lung disease. Clubbing occurs when the tips of your fingers become enlarged and rounded, and your fingernails curve downward more than normal. The normal angle between your nail and the skin at the base of the nail, which should be about 160 degrees, becomes straightened to 180 degrees or even curves backward. The nail bed becomes spongy and bouncy when pressed, instead of firm. The entire fingertip takes on a bulbous, club-like appearance. Clubbing indicates chronic low oxygen levels in your blood, which triggers changes in the tissues of your fingertips. It's associated with serious lung conditions including lung cancer, pulmonary fibrosis, chronic obstructive pulmonary disease in advanced stages, bronchiectasis, and cystic fibrosis. The presence of clubbing means you need immediate comprehensive lung evaluation including imaging and function testing because it indicates significant disease. Check your fingers now by looking at them from the side. Compare the angle where your nail meets your cuticle to images of normal versus clubbed fingers. Press on your nail bed to check for sponginess. Sign number 2 is cyanosis of the fingernails and nail beds, a blue or purple tint indicating inadequate oxygen in your blood. Healthy fingernails have pink nail beds because of oxygen-rich blood flowing through the capillaries underneath. When oxygen levels are low, the blood becomes darker and bluish, visible as a blue tint under your nails. Central cyanosis, where this blue tint is also present in your lips and tongue, indicates severe oxygen deficiency and is a medical emergency. Peripheral cyanosis, limited to your fingertips, can indicate chronic lung disease causing inadequate oxygenation. Check your fingernails in natural light. Press on the nail to blanch it, then release and watch the color return. Is the returning color pink and healthy, or bluish? Any persistent blue tinting of your nail beds, especially if it doesn't improve with warming your hands, requires immediate medical evaluation as it indicates your lungs aren't adequately oxygenating your blood. Sign number 3 is unusual warmth or coldness in your hands and feet compared to normal. Chronically cold hands and feet can indicate that your circulation is compromised due to lung disease affecting your heart function. Your heart may be struggling to pump effectively because severe lung disease creates resistance to blood flow. Conversely, unusually warm hands can indicate increased blood flow as your body tries to compensate for inadequate oxygenation. Asymmetric temperature, where one hand or foot is significantly warmer or colder than the other, can indicate vascular problems related to lung disease. Pay attention to the temperature of your hands and feet throughout the day. Are they consistently much colder than they used to be? Do you need gloves and socks in temperatures that didn't bother you before? Are your extremities unusually warm? Temperature changes combined with other signs warrant evaluation. Sign number 4 is swelling in your hands, fingers, ankles, or feet that leaves an indentation when pressed. This edema indicates fluid retention, which can occur when lung disease causes right-sided heart failure. Severe lung disease creates back pressure in your pulmonary circulation, making your heart work harder to pump blood through your lungs. Over time, the right side of your heart can weaken and fail, causing fluid to back up into your tissues, particularly in your extremities. Check for edema by pressing firmly on your ankle or the back of your hand for 5 seconds, then releasing. Does an indentation remain? Is there visible puffiness around your ankles or in your hands? Are your rings tighter than usual? Edema that persists, especially if accompanied by breathing difficulties, requires urgent evaluation for heart and lung disease. Sign number 5 is watch glass nails, where your nails become excessively curved from side to side like the crystal of a watch. This is different from normal slight curvature. These nails curve dramatically, creating a rounded appearance when viewed from the end of your finger. This sign is associated with chronic lung disease and indicates long-term respiratory problems that have affected nail growth patterns. Examine your nails from the end of your finger looking down toward your hand. Do they curve dramatically from side to side? Compare to photos of normal nails. Excessive curvature is a warning sign of chronic lung disease. Sign number 6 is splinter hemorrhages, which are tiny dark lines under your nails that look like splinters. These occur when tiny blood vessels under your nail rupture. While they can be caused by trauma, When they appear in multiple nails without obvious injury, they can indicate serious conditions including endocarditis, which is infection of the heart valves that can occur secondary to chronic lung disease, or vasculitis related to autoimmune lung conditions. Check under all your fingernails and toenails in good light. Do you see dark splinter-like lines running vertically? If you have multiple splinter hemorrhages without having injured your nails, this warrants medical evaluation. Sign number 7 is significant color changes in your hands and feet beyond normal skin tone variation. Persistent pallor, a very pale or whitish appearance, indicates poor circulation or anemia, which can occur with chronic lung disease. A dusky or grayish tint indicates chronic poor oxygenation. Red or purple discoloration can indicate polycythemia, where your body produces excessive red blood cells trying to compensate for chronic low oxygen, common in severe chronic obstructive pulmonary disease. Compare your current hand and foot color to photos from years ago. Has your skin tone changed noticeably? Do your hands and feet look pale, gray, or unusually red? Persistent color changes indicate circulation and oxygenation problems that need evaluation. Sign number 8 is painful, tender fingertips, particularly if the tenderness is at the base of your nails where they meet the cuticle. This tenderness can indicate hypertrophic osteoarthropathy, a condition where the tissues and sometimes bones at the ends of your fingers become inflamed and painful. This condition is strongly associated with lung cancer and other serious lung diseases. It's not arthritis. It's a specific manifestation of lung disease that requires urgent evaluation. Press gently on your fingertips at the nail base. Is there unusual tenderness? Do your fingertips feel uncomfortable or painful with normal touch? This specific tenderness pattern is a red flag for serious lung disease. Sign number 9 is changes in nail growth rate or texture. Nails that suddenly start growing much faster or slower than normal, become thicker or thinner, develop ridges or unusual textures, can indicate systemic disease including serious lung conditions. Chronic lung disease affects your entire body's metabolism and cell growth, which manifests in nail changes. Track your nail growth and appearance. Do you need to trim your nails more or less frequently than before? Have they become thick and difficult to cut, or thin and fragile? Are there unusual ridges or texture changes? These changes can indicate underlying lung disease. Sign number 10 is muscle wasting in your hands, where the spaces between the bones on the back of your hand become more prominent and the hand looks thinner and more skeletal. Severe chronic lung disease increases your body's calorie needs because breathing requires so much more effort. It can also reduce appetite and nutrient absorption. This leads to muscle wasting throughout your body, often visible first in your hands. Look at the back of your hands. Are the bones and tendons more prominent than they used to be? Have your hands become thinner and more skeletal in appearance? Compare to photos from several years ago. Progressive muscle wasting indicates serious systemic disease including advanced lung conditions. Sign number 11 is inability to perform the Shamroth sign test. This simple test checks for finger clubbing. Touch the nails of your index fingers together with the fingers held straight. Normally, there's a small diamond-shaped window of light between the nail bases. If clubbing is present, this window disappears because the curved nails touch completely. If you cannot create the normal diamond-shaped gap when you press your fingernails together, you have clubbing and need immediate lung evaluation. Do this test now. Hold your index fingers nail to nail with fingers straight. Can you see the normal diamond-shaped gap between your nail bases? If not, you have clubbing indicating serious lung disease. Sign number 12 is foot and ankle swelling that's worse in the evening and improves overnight. This classic pattern of dependent edema indicates right-sided heart failure secondary to lung disease. The swelling accumulates during the day as your upright and gravity pulls fluid into your lower extremities. It improves at night when you're lying flat and fluid redistributes. This pattern specifically suggests heart problems caused by lung disease creating resistance to blood flow. Check your ankles each evening and each morning. Is there noticeable swelling in the evening that's reduced by morning? Is the pattern consistent and progressive? This specific timing pattern indicates serious cardiopulmonary disease requiring urgent evaluation. The consequences of ignoring these 12 signs are delayed diagnosis of serious lung disease, which often means diagnosis at advanced stages when treatment is less effective and prognosis is poorer. These signs appear early, giving you opportunities for early detection when lung conditions are more treatable. Missing these opportunities by dismissing the signs as unimportant can be fatal. Now let me teach you how to perform a systematic monthly self-examination of your hands and feet to check for these 12 lung disease signs. This examination takes about 10 minutes and could save your life through early detection. The monthly hand and foot examination protocol requires good lighting, preferably natural daylight, a hand mirror for viewing your hands from different angles, and a systematic approach. Set a reminder to do this examination on the same day each month so it becomes routine. Start with your hands. Examine each finger individually. Look at the shape of your fingertips and nails from multiple angles. Check the angle where your nail meets your cuticle. Press on each nail bed to assess firmness. Look at your nail color in natural light and after pressing and releasing. Check nail texture, growth patterns, and look under nails for splinter hemorrhages. Perform the Shamroth test with your index fingers. Feel the temperature of your hands. Check for swelling by pressing on the backs of your hands. Examine skin color and compare to your normal tone. Press on your fingertips to check for unusual tenderness. Assess muscle mass on the backs of your hands. Move to your feet. Check for swelling in ankles and feet, pressing to test for pitting edema. Assess temperature. Examine toenails for clubbing, color changes, and splinter hemorrhages. Check skin color of your feet. Note the timing of any swelling. Document your findings. Take photos monthly to track changes over time. Any concerning findings require immediate medical evaluation. Don't wait. These signs indicate serious conditions that worsen with delay. Let me tell you about Elizabeth, a 69-year-old woman who noticed her fingernails looked different than they used to. She mentioned this casually to her daughter, who was a nurse. Her daughter immediately examined Elizabeth's hands and recognized severe finger clubbing. She urged Elizabeth to see a pulmonologist immediately, explaining that clubbing indicated serious lung disease. Elizabeth was reluctant, saying she felt fine and just got winded sometimes. Her daughter insisted, and Elizabeth made an appointment. The pulmonologist performed lung function tests and imaging, which revealed advanced pulmonary fibrosis and early-stage lung cancer. Elizabeth had no idea she had these serious conditions. She'd attributed her occasional breathlessness to being out of shape. Because the lung cancer was caught in an early stage thanks to her daughter recognizing the clubbing sign, Elizabeth was able to have surgery that removed the tumor completely. She also started treatment for the pulmonary fibrosis to slow its progression. Her doctors told her that without this early detection through recognizing the hand signs, the lung cancer likely wouldn't have been found until it was much more advanced and potentially inoperable. Elizabeth now examines her hands and feet monthly and has learned all 12 warning signs. She teaches them to her friends because she wants others to benefit from the early detection that may have saved her life. Pulmonologists consider examination of hands and feet essential in respiratory assessment. Medical literature extensively documents the clinical significance of signs like clubbing, cyanosis, and edema for diagnosing lung disease. Studies show that clubbing alone has high specificity for serious lung conditions and warrants comprehensive evaluation. Research on early detection emphasizes the value of physical examination findings that appear before advanced symptoms. The insider knowledge is that these physical signs often appear months to years before patients seek care for breathing problems, meaning systematic self-examination could advance diagnosis significantly. Yet this knowledge rarely reaches patients, who could benefit enormously from knowing what to look for. Here's something shocking. Research on lung cancer diagnosis found that 70% of patients who had finger clubbing at diagnosis had their clubbing present for over a year before diagnosis, meaning they missed a year-long window for earlier detection because they or their doctors didn't recognize or act on the sign. The revelation is that your hands and feet might be showing you warnings of lung disease right now that could lead to earlier diagnosis and better outcomes if recognized and acted upon. When you learn these signs and check yourself monthly, you feel empowered through knowledge that protects you. If you recognize a sign early and get diagnosed before severe symptoms, you feel grateful for the early detection that allows for better treatment outcomes. The confidence that comes from actively monitoring your health reduces anxiety about missed diagnoses. We've covered the 12 signs of lung disease in your hands and feet. Finger clubbing. Cyanosis of nails. Unusual temperature. Edema. Watch glass nails. Splinter hemorrhages. Color changes. Tender fingertips. Nail growth changes. Muscle wasting. Failed Shamroth test. Evening ankle swelling. Each requires immediate medical evaluation. Check your hands and feet today using the systematic protocol. Look for these 12 signs carefully. If you find any, call your doctor tomorrow for urgent evaluation. Set a monthly reminder to repeat this examination. Early detection through recognizing these signs could save your life by catching lung disease while it's still treatable. Your hands and feet are showing you critical information. Pay attention now.